Hi everyone, and welcome to the Medicare Patient Eligibility Denials webinar. We will focus on why we are denying claims for Medicare patients and answer your questions. I'm Tom Ryan with Provider Outreach and Education, and I'll be your presenter today. Today I'm joined by Ashley from my team, who's going to help monitor the chat. Ashley will be adding different resources and links in the chat. She's going to look at the questions. She may answer some of the questions directly in the chat, or she may pose them to me verbally when I ask her and prompt her to do so. So definitely you will want to put your questions into the chat. I would like you guys to remember that we do offer disclaimers at the end of the presentation, so take a look at those if you are interested. So what are we looking at today? Well, our objective is to help you avoid patient eligibility denials and to provide you some resources for future use. What we've done is actually looked at data. So we went through, we analyzed data, and we find out, hey, patient eligibility denial, yep, we have an issue. Okay, so how do we get around it or how do we work with it? And that's what we'll talk about. Um, I do want to welcome those of you that are new to Medicare and let everyone know that we did have a few people that said, hey, I'm new and I need to start at the beginning. I do want to welcome a couple of you that are really new to Medicare. This is one of you in particular said this was your second week working with Medicare. So that means this may be, like your seventh or eighth day working with Medicare. So I do need to step back a little bit, and some of this information is geared towards that. So I will stop at a point and ask Ashley just for us a confirmation that we don't have any questions coming to chat, and if we do, we want to take those so we don't lose anybody along the way. The next thing is we're going to look at the data. Why are we even educating on this? Then we're going to talk about, hey, where can I check eligibility and how do I do that? And then we're going to talk about some actions that Medicare will take. So hopefully all of that will get you through what you need to know. Again, please use the chat feature. It's very important that we get your questions somehow along the way. So who's eligible? Now, I do want to remind you that this is a section that is high level and it's a brief overview. It's not going to get into all the in-depth details of who's eligible. That's a whole class in and of itself. But I do want to provide a little bit of information for those of you that are new to Medicare. Maybe you haven't had the opportunity to really delve into this yet. And we want to make sure we meet your needs as well. Let's start with this review. So, someone who's eligible for Medicare would have been someone who worked in the United States and paid the Social Security Administration or the Railroad Retirement Board the Health Insurance Contributions Act, or Federal Insurance Contributions Act, FICA. So when you look at your check and you'll see that terminology, okay? However, we don't determine eligibility at the MAC, Medicare Administrative Contractor, or MAC. We don't determine eligibility. Again, as I said, the Social Security Administration does, and so does the Railroad Retirement Board. Now, us as an AB MAC, we don't work with the Railroad Retirement Board. We work with Social Security eligible people. They have to be determined by that. So it's two different MACs. So when you look at that, who becomes eligible? How do you become eligible? Well, again, and you've heard me say this quite a few times, you have to have worked in the United States and paid in. You have to contribute. You can, but it's not just you. You could also be eligible under your spouse. So if your spouse is the working person, that's fine. You could also be eligible under your child or a legal guardian. Now, the reason we use the term legal guardian is, let's say that you have a disabled child, they could be eligible underneath you, or you have a foster child or someone like that that you have legal guardianship of, they could also be eligible underneath you. So it's very kind of a different spectrum when we look at it. So when you look at these type of eligibilities, we're going to go on just a little bit further and I'm going to define them. The first one we want to talk about is when you're eligible by age. Okay. The question for eligibility about age is it the person's 65th birthday by date, or how does that work? And so let me answer that question. First, age is the largest eligible population. The date of birth, or DOB, it is set so that it is the first of the month in which you turn 65. It is not the actual day you turn 65. The second part of that is, unless your birthday is the first of the month, and then it's the first of the month prior. So here's how this works in a more practical way of saying it. If your birthday is January 1st, you will be eligible December 31st, which is the month, or December 1st, which is the month prior. January 1st would be December 1st. If your birthday is the 2nd through the 31st, then it is January 1st. You will get an eligibility card. The eligibility card comes from your local Social Security Administration. It's a Medicare card and it will have an effective date. We do get many types of claims that come in and the person's not eligible yet because once they get their card, they're like, yes, I have Medicare. They run in and give it to the provider's office and the provider bills it without looking at the actual date on the card. So we want to make sure that that's number one. Look at the date on the card and make sure they're actually eligible and that you don't begin billing before that date. Okay. So that's age related. Now there is another category for Medicare eligibility, and it is done through the Social Security Administration, just like the other one, but it's Social Security Disability, SSDI, which is Social Security Disability Income. These people are under 65 when they become eligible for Medicare. They are deemed eligible by the Social Security Administration and typically have a 24-month waiting period before eligibility begins. So that means you start receiving SSDI, disability income. When you get that disability income, you wait 24 months. That doesn't mean it's always 24 months. So we listed just a couple of, or like one example in particular of where someone would immediately become eligible once it's reported to the Social Security Administration, and that is ALS or Lou Gehrig's disease. So we know that that is a situation that is an exception, but again, we don't determine that. The Social Security Administration does. They say, yes, you're eligible for SSDI. They put that into the system. The system is the Medicare eligibility system, which then communicates to us. So there's two different ones. Does mean that you're still eligible under yourself, a spouse, a child, a legal guardian, same category of eligibility. It's just how are you eligible? Hopefully that makes sense. The third category that falls within eligibility is in its own separate section of the Social Security Act. So this is end-stage renal disease. What this particular portion of eligibility says, once reported to the Social Security Administration, there's a 4-month waiting period for eligibility. Again, there's a caveat, and it says unless they start self-dialysis, then it can begin earlier. That's all investigated and determined by the Social Security Administration. As our Medicare administrative contractor, we just use whatever they're putting into the eligibility system. If you have end-stage renal disease, you can be younger than 65. You can be eligible on disability and end-stage renal disease, or you can be eligible on workers, which is 65 and over, right? Age-related worker, or age-related Medicare, not worker, age-related Medicare. You can't be disabled, age-related. It doesn't work that way. You're either age-related, 65 and older, which trumps the other two, or you're eligible under disability, end-stage renal disease, or both of those together. So it really just depends. Um, One thing to note with end-stage renal disease, this can end or terminate if there is a successful transplant or if someone chooses to stop dialysis. So if it's a successful transplant, they can end their basic eligibility for 12 months after the successful transplant. I'm sorry, 36 months after the successful transplant. The one caveat is they will still continue to receive Medicare eligibility for the anti-rejection drugs because that makes sense. We don't want them to reject and then have to start over. And okay, so if it's the 36-month, the bottom bullet, they still could be eligible for the anti-rejection drugs. If a patient chooses to stop dialysis, they are allowed to stay on Medicare for 12 months after their last treatment. If they do not restart treatment or something doesn't change, then they will end the Medicare. If a person is not eligible for any of these categories, the system can be updated from the Social Security Administration. You are not required to bill Medicare at all, and you can charge the patient. Medicare is out of it. There's nothing to charge us. We know they're not eligible. If you do bill and the patient is not deemed eligible, it is their responsibility. Medicare will process the claim as their responsibility because that patient is not eligible. I think I got through all the base level questions that go with that. A couple people did ask a little bit about this next slide, which is premiums. And how does that work? Well, I want to remind you that if someone chooses not to pay a premium, they can not have Medicare. They could not have Part A. They could not have Part B. They could have Part A but not Part B, or Part B but not Part A, because that's the premium they're paying. So the question was, why would someone not have Part A? And I think this is going to be answered in just a few moments. Now, Part B is always a premium. Always. Everyone pays a premium. It is an income-based premium. So this one's a little different, and it is based on the premium levels. Um, if they choose not to pay that premium, which means they go back to Social Security and say, no, we're not paying it, that's okay. But what happens is they then become not eligible for the Part B benefits. If you don't know the difference, a Part A benefit is a facility or an inpatient style benefit, and a Part B benefit is a facility outpatient benefit, professional service benefit, and a supplier benefit, such as labs, ambulance, things like that. So they're very different. On the Part A side, most people eligible for Medicare will get what is called premium free. They don't pay a premium. The caveat is that someone or themselves has to have worked 40 quarters or more, and that has to be reported to Social Security. If that person has worked at least one quarter, but under 30, which is 1 to 29, then they do have to pay what is called full premium. This in 2026 is $565 a month. So you can see that's very high, and they may say, ooh, I can't afford $565 a month. Therefore, I'm going to decline my inpatient coverage. That's the Part A. If they've worked 30 quarters to 39 quarters, Medicare does say, okay, you have paid in. We're going to reduce that because you're almost there, but not quite. And that we will reduce to $311 a month versus free at 40. So the premiums are very different. Hopefully that makes sense to everyone, and why some people may or may not have it. Now, have it being the type of coverage. So please verify that they have this type of coverage. If you look right here on the bottom, we do have the Medicare cost. It's just a fact sheet. I'm going to go ahead and select it just so you can see what happens when it opens. It's going to take just a second. What I'm doing is actually going to have it go out to the website and open. Here's just the Medicare cost sheet. One of the reasons I like this cost sheet is it is aimed at a patient. It's on the Medicare.gov website. It is a publication, and here's the number. Medicare.gov, for those of you that are not familiar, is a patient website which has a patient portal. The provider website is CMS.gov. This fact sheet is just very simply laid out to help you get through it. Okay, just very, very quickly, very simply laid out. By getting through it, you can provide this to a patient. You can explain it with the patient. The patient has further questions, they need to call 1-800-Medicare. If they're having issues with premiums or whatever, that's all Social Security. It's not you, it's not me. The Medicare administrative contractor can't fix or do anything with it, but I just really like it because it does help the patient understand what they may or may not have to pay. Okay. Here is the Part B premium cost, and you can see it does vary based on income. All right. So just a good opportunity for you guys to use it. If you're not familiar with it, the website, again, medicare.gov, you're going to go your basic information. Oops, sorry, I forgot to close out of that. Go to your basic information, and it's in forms and publications, and then you can look it up from there in the publications section. Medicare and You Guidebook, I think this is an awesome publication if you're not familiar with it. The reason that I like this one so much is that it also contains the information I'm showing you, but this is the official guide sent to CMS beneficiaries. In other words, your patients. You can actually see what CMS requires them to know each year. So just something to look at. All right, one more slide. Retroactive eligibility. For those of you that did ask about this, I really wanted to cover this. We had quite a few questions come in, and there's some issues going on, and I do understand this. First, Social Security can backdate someone's eligibility. It's typically not done for someone who is working aged, which means 65 and older. They don't really have that, right? You're 65, you either paid the quarters or you didn't. Good. However, it is very common with two different types, and that is disability and social and ESRD. The reason it's common with disability is what if someone fights for disability income and CMS does make the determination that you should have had it in the first place and it's 30 months ago. Well, then they retroactive back for that 30 months, which means now suddenly claims are eligible for the last 6 months. Oh man, okay, now you got to go back and rebuild those. So retroactive eligibility is definitely a thing. With end-stage renal disease, it requires a doctor to report to the Social Security Administration that a patient has this. That requirement, if it doesn't happen timely, then it can retroactive back. We had an example of this where a doctor actually reported it 6 years after the patient started and was diagnosed with end-stage renal disease and had been receiving dialysis for approximately 4.5 years when it was reported. Now you can imagine all the claims that had to be retroactively billed. Okay. The providers found out and they're like, oh man, now what do we do? And that's where you need to request a timely filing waiver. Please don't send an appeal. Don't send a level one redetermination request, which is a level one appeal. It's timely filing waiver. You do need to attach the requested information for the waiver, which explains why you're requesting this in the first place. Attach proof of that, and then any paper claims. Yell 1500 claim form or or UB04. Yes, they need to be attached, and yes, they need to be the official. Some people call them red, some people call them pink, whichever one you want to call it, but it needs to be the official paper claims. If you're interested in more on this, I do have the Medicare Claims Processing Manual that talks about Medicare retroactive eligibility. And then I also have an article from WPS talking about timely filing. I'm going to use this one just for a second. Okay. We're going to look at this article. Well, maybe we're going to look. There we go. Um, and you'll see it just explains all the different pieces of information that you need. Okay, you can use the direct link. If you're not a link, just search it right here. Search timely filing right up here. And you're looking for timely filing of claims. It'll walk you through what we need from you. It'll give you all of the resources and the information that you need to look up the different things. It'll also then instruct you where to send your information. Okay. Why do we talk about that? Because we continue to receive redetermination requests for this eligibility denial, and it is not a redetermination request. This slows your valid level one appeals down and actually makes us reject them and send them back and say, hey, why aren't you doing this? Here's your steps. I want to remind you that these addresses are based in what you picked up here on the top. And let me just explain this because I did have a question come in. And the person is saying, hey, based on your website, when I look at eligibility information and how to fix some of the problems that I'm having, I'm still getting things not working. Now, my initial reaction would be, are you using our website correctly? Seems pretty basic. I'm billing a Part B benefit, therefore I should select Part B. That's not how our website is laid out. Our website is laid out by CMS line of business. By default, CMS gives us 4 lines of business in our 2 contracts. First line of business is anything billed from Iowa, Kansas, Missouri, Nebraska, or the national portions. So that is J5. Also, Then they break it down further and they say, are you billing on a UB04 or an 837I? That line of business is considered Part A. It's not a benefit category, right? It could be outpatient hospital, which is a benefit category B, but it's still billed as a Part A claim according to CMS line of business. So when you look at this, you want to make sure you're getting this to make sure you get, I'm sorry, these answers right here correct, okay? Um, Now the Part B is only for 1500 billers. If you're a 1500 or an 8, I'm sorry, 1500 and 837P billers, again, same states, Iowa, Kansas, Missouri, Nebraska, but only billing for the 1500 or the 837P. Take the two claim types again, the 1500 837P or the UB04 837I, and apply it to J8. J8 is for Indiana and Michigan. So we'd say, hey, what form are you billing on? Oh, you're in Indiana, then you want to pick one of these two. Again, the reason it's really important is because people are getting the wrong information and they're not getting their claims processed due to that. We don't want that. We want you to get your claims processed. Want to help you out. So, a little bit again about retroactive eligibility. Please make sure that you are following the directions given here. It is something that is there. If you're looking for that chapter that we were talking about, that's this, the general billing requirements and what it actually states. Okay. Before I go on to the data, which would be the next section, I do want to stop for a second and see if anyone had any claims, because I went through a lot of information, but it's really high level stuff to try to get everyone back on the same page. So Ashley, any questions submitted yet?
We do not have any questions in the chat yet.
All right, perfect. Let's go on. Again, please you guys take the time. This is your opportunity to ask me whatever you need. The data comes next. So why are we even looking at this? Well, the first thing I need you to know is we're looking at it because when we look at data, WPS is constantly analyzing data. We're constantly trying to look at what's going on. Now, we do analyze data from both Part A and Part B. Now, those are benefit categories. But when we look at that, we do analyze it based on the processing systems, which is line of business. So please remember that that's a really interesting set of information. And the line of business is, you'll see on the bottom, two different sets or two different processing systems. This, the physical intermediary standard or shared system, and MCS, the multi-carrier system. This is used for Part A and B claims, benefit category claims, billed on a UB04 or an 837I. This means inpatient and outpatient facility claims. MCS is only for benefit category B, billed on a 1500 or an 837P, and this is your professional services, your suppliers, things like that. So when we look at that, and if I'm referencing something, I just want you to know where the data is coming from and what I'm looking at. During this class, I did look at data for claims that were submitted between 11/1 and 1/31. It was refreshed on February 9th, so I did have the most current data as I was kind of prepping the amounts. All right. What I looked at was to say, okay, eligibility denials. What do we have? What are they causing and how much money is it costing? Then I looked at how many lines we have rejected. I did not look at certain, individuals. I looked at overall categories. That's where this stuff comes in. I listed some top stuff here for you just so you can see it as we go through. These types of rejections together, now I say rejections, it's really rejections, denials. Also, there's some that are unprocessable, which is an MCS claim that is not processable. We can't fix it. We can't do anything with it. And sometimes it's, hey, we can't process it because we don't have enough information, such as the name, date of birth match, things like that. Could also be a return to provider, which is a FIS denial, and that's, a fish return, which is the same thing. It just, we can't process that claim. So bear with me as I use the term interjectively there. But again, you can see the dollar amount. Total, it's $51 million. And then it says, hey, before eligibility is 22 million. After eligibility is 10 million. After death is 8 million. And then after incarceration, and we do have some questions on this, we'll talk more about it, it's 6 million. There's a mismatch. Something doesn't work together. It's a little over 2 million, and not covered period is $683,000. Not covered is the one we talked about where a person loses their Medicare eligibility for a period of time. Could be end-stage renal disease, could be they didn't pay their premiums, whatever's going on there. So a little bit on the data, just wanted you to have it. I'm not going to like go through everything individually. I was asked to say how many people does this affect? So I pulled the Medicare beneficiary or your patient's data and put it together this way. Total providers affected is 80,000, a little over 80,000. And total patients, this is just under 100,000. And then we went through those individual breakdowns again, and the top breakdowns are there. So this is something that Medicare does look at. Now, when I say Medicare, CMS does look at our top denials. What are we seeing within our states, and are we educating you on this? So this is where a lot of people need the education, need the information. I will go over some of the different denials, and we'll do some different things with those. But I want to remind you that the basic fix is all the same, right? You got to check eligibility and make sure the patient denies. We'll talk a little bit about that as we go. Okay. So checking eligibility is next. Ashley, any questions on the data portion? Again, it was high level, but it is what it is, and it's there for you.
No questions in the chat.
Perfect. All right, so when we check eligibility, this is the starting point for anything about eligibility because you have to know what they're eligible for. There are other caveats and things that happen. The eligibility transaction is usually the HETS, the HIPAA eligibility transaction system, HETS, and it's a 270 and a 271 electronic transaction. You can get this through a vendor directly from CMS. Now, sometimes you have to pay a premium to that vendor or you pay an amount for that. We do offer that for free. So we'll talk more about some of those different tools because they become really important. Okay. So the fix. One, start with the basic. It's before their eligibility date. So if you are looking at the screen, you can see the screen. The hand shows the Medicare card. And if you notice, there are two dates on that card. That card says, hey, the patient isn't eligible until 3/1. Well, what did we learn about that? It can be sent up to 90 days before that. So they can actually get this roughly on 12/1 and anytime in between there. Who determines that? Here's the thing. It's determined by the Social Security Administration's local office who actually sends the person the card. That's why we can't say it's always 30 days or it's always 60 days or it's always 90 days. We don't know what's going to happen with that Social Security Administration. On the other hand, we can tell you that when a patient presents you with this card, you need to verify the date on the card. Okay? You also should then take the information from the card and verify within an eligibility system. We'll talk more about those in just a moment. If the patient is not eligible, and we talked about this previously, but I want to remind you, if the patient's not eligible before, after, because there's a break, something happens, then we need you to bill the patient. It is the patient's responsibility. If you say, wait, this patient has maybe a primary payer through a group health plan or like an employer-based insurance, yeah, you can bill them. It's just Medicare doesn't need the bill because we're never going to pay it. The patient's not eligible, right? So there's a variety of different factors that happen. You could bill Medicare, especially if there's a lapse in coverage in the middle. That lapse in coverage is given by the Social Security Administration or whatever, and the primary says, "No, I need this. I need this. I need this." Go ahead, bill Medicare. You get it. We just aren't going to pay it, and we're going to make it the patient responsibility. So hopefully all of that does make sense. When we look at that card, it becomes very important. I also want to remind you, and you can't see this, but on the very bottom of the card, there's a red stripe. If you see railroad retirement board in that red stripe or railroad of any way, that means it is a separate Medicare administrative contractor and you do have to bill them. So if you bill us as the part A and B Medicare administrative contractor or claims processor, we will send you a notice saying, hey, we forwarded this claim to the Railroad Retirement Board. But that forwarding process can take time. So please just make sure you check that before you do that. All right. Now, I know I said a lot, and I said, hey, by the way, you should be checking our systems, and you should use the 270, 271 electronic HIPAA transaction. But how do you get access to that? Well, the first way to get access to that is a free way to get access to it, and that's from us. So if you've billed WPS and you are one of our providers or you represent them, you can have access to this through SNAP, the Secure Net Access Portal available on our website. Um, I will tell you, this is going to give you a link to the user manual. You can see a picture of it. I'm going to take you to the website for a moment. We'll talk a little bit about it and kind of how you're going to use it and look it up based on this data. Okay, so let me do that. Ashley, can you verify that our website did come up and that you guys can see this again?
Yes, I can see the website.
All right, perfect. Everywhere on our website, we want you to have access to Snap. Again, Snap is the portal. I'll just simply usually call it the portal, so you'll hear that all the time from me. The portal is right here. Okay. So again, on the first part, on the first page you come to, here's the portal. If I move around anywhere within it, the portal remains there until I log in. This portal is designed by an individual, so you will have to have a unique username and password and be granted based on NPI to a provider's information. Okay. If you don't know about the portal and you want to register, please feel free to use this button. But if you need help, even through the registration process, you do get to use the portal user manual. So again, you're going to come and you're going to select on the right side in the portal section, which is in a header, the portal user manual. Okay. I'm going to scroll down into the body, and you can see in the body, first of all, a very light green button. It appears light gray to some people. Just depends on how your colorations are set up. And it says download. This will allow you to give the entire manual. If you don't want the entire manual, please feel free to scroll down. Please feel free to look away from the screen for a second. I'm going to fast scroll down to the eligibility section. When you get down into the bottom, which is again the body, you want to go under patient and go to the eligibility and select eligibility check. This will then allow you to access a lot of information about the patient's eligibility record, but it is more than just Part A and B eligibility. And we're going to talk a little bit about some of that as well. Let's scroll down. And you can see it's going to give you, okay, this is where you're going to go. It's going to have a little bit of a look. I'm going to scroll down again. It's going to give you first, enter the data. Second, this first screen to display after you hit search will be a screen where you can select eligibility or supplemental. This means that the insurance, the supplemental insurance, pays after Medicare. So probably not what you're looking for. The eligibility piece will automatically default and is what you're looking for. Now, the reason that this is important is it's going to give you a start date and an end date, and this is what you entered. So you told us above you wanted a data service, and this is where we get that from. You entered it, uses the system. Okay. So you scroll down a little bit more, you're going to get what's called a summary. The summary is just a basic level overview, and here's what you're going to have. It's not a whole lot of information. What's great is it is the Medicare benefit summary, but it's not about what's currently going on. It's just, hey, annually for the year that you entered, here's what their benefits are. All of the other fields are individually targeted to the data service you entered and about certain things. Your basic Part A and B deductible and eligibility are here. Now, if it says, hey, wait a minute, so scroll down, we're going to look at Part A first. It says, okay, here's your coverage year. If they're not eligible, it's going to say, hey, there's nothing there, right? Hospital and SNF, two of the biggest inpatient types. For Part B deductible, it says, here's your coverage time. So if it says not eligible, again, what are you billing with that, right? It will give you under MA, which is a gray box right now on this one, but it does, if you patient had this, it would light up blue like all of the other ones above, and it tells you whether they have an MA plan. Some people said, hey, is this really eligibility? They are still eligible for Medicare, only you don't bill us, you bill the individual plan the patient has elected. There's an exception to that, but that's a whole lot more caveat than we're going to get into for this. So this is where you're going to get that eligibility information. And yes, this is a HIPAA eligibility or 270, 271 transaction. It's free. We do require you to be a Medicare provider with WPS, which means you have to be enrolled and you have to have submitted at least one claim to be eligible. You, as someone who does have that information, you have to be approved by the NPI administrator for that information. So that's how it all works there. Okay. Um, Another system that a lot of people like to use, which is actually going to move to the next slide, is slide 18 and or 17. I'm sorry, slide 17, and it's called Direct Data Entry or DDE. You can move around and search for this. So if I would go to the topic center and I select claims, you'll see right here in the top the direct data entry overview. Again, you'll see DDE, but you could also just put DDE up here in the search and you'll get it this way too. Okay. I'm just going to go to the overview real quick. Again, you can look at this and say, what does it give me? It's going to explain a little bit about how you get it, a little bit about the system itself, what you have to do. And comes to the bottom. See the manual? Select that. Okay, it's not opening. There we go. You can download the entire manual. I'm just going to select it again. Now again, direct data entry is for certain providers, and that's what it explains. It is only for FISH providers. It's not about a benefit category. It's about how you bill us. If you bill us on a UB04 or an 837I HIPAA standard transaction, you can have access to DDE. If you bill in a 1500 or an 837P, this system is not available to you. What this will do is help you walk through every screen available. Okay, so yes, you have to do the enrollments and all that. It's going to explain all the different criteria, all those different things. So hopefully that does help you a little bit and kind of walk you through the different pieces for direct data entry. The last one is actually from the CMS website, cms.gov. And again, you can have access to the same transaction that we display the information for you. Now, I can tell you the long steps. I don't even like using that. I just like to say, let's just go to HETS, HIPAA eligibility transaction, hit enter, and CMS gives me right here the information without me having to try to guess my way through it. The one catch is you have to know that it's either HETS or a 270 or 271 transaction. So other than that, you're not sure, you could just type the word eligibility. It will bring it up, only it brings up a lot more results. Once you're inside the HETS transaction, it's just going to talk about the transaction itself. It's going to tell you how you get connected, all of those different things. Again, this does require a vendor, and a vendor may charge you for it, where it's going to give you the same information that we offer in our Snap or our portal, and our portal is free. It's completely free. Okay. So those are some different ways to start off with. Yes, you need to verify. Yes, the card is still there. Now, here is a caveat that a lot of people don't realize. They have a Medicare card. They are eligible today. But what happens if they lose eligibility? Nobody goes and snatches that card from them. Nobody goes and takes it away. Nobody gives you a new card that says, hey, you're not eligible from this time to this time. That doesn't happen. Instead, they have this card and they look eligible, but they aren't. And then you have to rely on the Medicare systems to have that information. Okay. Now I will tell you sometimes the system looks different and you're like, wait a minute, what's going on? We do not update the system ever. Did you guys catch that? We do not update the eligibility systems ever. It has to be done through the Social Security Administration. That information is done and then communicated to what is called the Common Working File, or CWF, which brings me to slide 20. So let me get back here and slip down to slide 20 for you. It's getting me the Medicare Actions section. Under slide 20, the Common Working File will get information from the Social Security Administration. It does receive it from the Railroad Retirement Board as well. Once that information is given to us through the Common Working File, it does update the 270, 271 HIPAA standard transaction, and we can display it for you. But did you catch that it has to be there first? So if the Social Security Administration is running behind or a local office doesn't have that updated, we don't know, just like you don't know. So how does that work when it does get updated, even in a retro act or whatever the situation is? What happens is the common working file can instruct us as a claims processor through the claims processing system to take money back. Nobody touches anything, but you're going to get money taken back. It's going to build that accounts receivable because you build a claim when the patient's not eligible during that time, or they're incarcerated during that time, or something's going on, and that is an automatic take back. Okay, it just happens. There's nothing we do with it. No one manually gets involved until you ask us to look at it. So it's a little bit about an unsolicited response. I was asked a couple more questions with that. Does an unsolicited response mean that you absolutely owe us money? The answer is no. An unsolicited response means the system is indicating that something happened and there's an eligibility reason that something is happening right now. However, if you disagree or the patient disagrees, they do need to go back to the Social Security Administration. We can't do anything until the eligibility system updates, which then updates the common working file, which then updates the HIPAA eligibility transactions, the 270, 271 transaction, which tells us whether or not we can process a claim. So it's very interesting. Um, somebody did ask about a grace period or like a time frame before we'll get an unsolicited response. We don't have any idea what that is. What we know is that once the unsolicited response is put into the system, or I'm sorry, once the response is put in that they're no longer active and they're no longer eligible, whether it's for premium, whether it's for end-stage renal disease, dialysis, end-stage renal disease, successful transport, whatever the situation is, they're not eligible, then we have to take action. That time frame, that grace period, if given, would be something that would be set by the Social Security Administration. So we don't really have a good answer for that one. However, if it is given a grace period, we will use that, but it is given to us. Hopefully that helps everybody. I'm not sure. That was, I know, a question that was asked. So this unsolicited response is very troubling to some providers, and they're like, why did I get this? Why am I getting an overpayment? So let me again explain a little bit about overpayment, and then we'll start with some questions. First, an overpayment from Medicare is simply a request to pay us something that was incorrectly paid. Incorrectly paid can be given from you saying, hey, you shouldn't have paid me, right? You can ask us to take money back. You can, and we can set that up for you. We can get an unsolicited response saying, hey, the system says take money back. We talked about that. That's what the common working file will do is it'll tell us to take money back. Just gets built. Nobody does anything, right? The third type is there can be a manual review. Now it can be us as an AB Mac. It could be maybe the coordination of benefits contractor. Um, they can do it. Well, yeah, they can say, hey, take money back from the provider. Sure, we entered a new record. Now that record is coming in and see and to the common working file saying, hey, they had. Those are all things that happen. All right. So then you have to look at it. So one of the questions that I got, which was a great question, is how do I give you money back? Well, let me show you on our website. Now, again, our website is the preferred method. There is a paper method, so I'll go through both, but I really would encourage you to start checking out this website, this Snap portion. All right, so we're back on the website. And we're back in the Snap area, the SecureNet Access portal. What I want you to do is again go back to the portal user manual, and there's two different areas you can look at. So when we scroll down, again, you can download the entire thing or scroll down. I'm just going to scroll quick, so look away, look away. If we come down, we want to look at transactions is the header. Under claims, you'll see the overpayment claim adjustment. And under finance, if I go down a little bit more, you'll see refunds. So if you're asking us to take money back, that's the claim adjustment. If you're sending us money back, that's the refund. So I don't know which action you're going to take, but either one will walk you through, just like with the eligibility, it'll tell you screen by screen what to do. On the other hand, there are times when that is not available, especially for those of you that bill the FIS system. Sometimes taking something back or doing something, making an adjustment to a claim, you're like, oh, it doesn't work. The system doesn't like it. What do you do? That's when you have to revert to paper. So this is where I like to go to get my paper. Tools, all tools, Then I scroll down and I'll see on the left side, the third box says all forms. Now, if you have a little bit bigger, it could be further down because it might only display two in each row, but let's just use all forms. When we open this up, you can search overpayment. You can go to specialties or by name. Um, I'm just going to put overpayment in the filter and let it do the work for me. So here's what I have. You can see, hey, wait a minute, it automatically filtered. Awesome. Then I want to know what we're doing here. Are you asking a question about an overpayment? Use the inquiry form. If not, though we have two different features in Snap, we have one form for both. So if you're sending something in paper, please make sure first you are on the right area of the website that you need to be in. We talked about that. Second, you're using the notification refund form. Once you do that, it'll talk about please use our portal. If not, proceed with all of this. I want to come down just a little bit. It's going to talk a little bit about some of the different fields. Then it's going to give you step-by-step instructions. This form has issues, and it's these three top fields. If these are not entered correctly, your money will not be applied correctly, or your overpayment may take longer than you really wanted it to. So please pay attention to contract, Medicare type, and state. We'll talk about that in just a moment because I'm actually going to open the form. So here's those three right here at the top. Contract is the same thing as line of business that we just went through. Okay. It is J5, Iowa, Kansas, Missouri, Nebraska, or national. J8, Indiana, Michigan. Medicare type is the billing type. So did you bill us on a 1500 or an 837P? You are B. Did you bill us on a UB04 or 837I? Then you're part A. And state, simply enter the initials for where the claim was, where the service was done. That's what we're looking for there. Okay. These again drive what information, what cues we have to go into to get things worked correctly so that they don't take extra time, so we don't start taking your money back in an offset, which is just simply when we start offsetting your claims payments. But the reality is you've already sent it. That is the problem that we're having today. Then we finally get it processed correctly, and guess what? Now we got to issue you a whole bunch of payments. Nobody wants to go through those steps. So that's why I thought I would bring it up and just kind of help you. It is a big issue with this situation for overpayments. What I'm going to do is now go back to the slides, which brings us to the question and answer session. I do have a variety of question and answers that are submitted and with the pre-submitted, so we're going to take a look at that. Before that, I just want to ask Ashley, are there any questions in the chat that I can quickly answer? And then as I go through the pre-submitted, it'll allow y'all to submit some more questions in the chat if you have them. So Ashley, anything?
We had a couple of questions come into the chat. The first one asks, is there a grace period if beneficiary stops paying the premium?
We don't know that. What we do know is that the Social Security Administration will tell us yes or no. Remember, I said it's that Medicare eligibility system and it communicates the common working file. So based on what the Social Security determines, it's yes or no for them. I will tell you that sometimes the Social Security Administration doesn't allow a grace period. They just straight out say it's not eligible anymore. Then the beneficiary goes back and says, oh man, it's my fault. I should have been paying this all along. Can we get that fixed up? And the Social Security Administration can allow that, making a retroactive eligibility situation. So it's really up to the Social Security Administration on what they allow. Next question, if we have one.
All right, the last one we have right now is, does CMS or WPS send notice that the NBIs are being updated, noticing lately that beneficiaries' NBI has changed or updated?
No, CMS and WPS do not do that. WPS in particular doesn't do that. We don't have any knowledge that it's updated either. The only time we look at the MBI or we do that is when you submit a claim, we check for validity on the claim. So we're not checking like regularly to find out if it's updated. We don't have a reason to know that. What we need to know is for that data service, is it valid at that time when you submit the claim? So we wouldn't do that. CMS relies on Social Security to do that. And so we do give you access in our portal to that information, and you can check for an update there. We don't really have a lot of information about it because the Social Security Administration does it for fraud and abuse. They don't issue those generally on an overall basis because while they're updating it is for fraud and abuse. So they're trying not to say, hey, we issued this because of a fraud issue or something like that. They do it individually to the patient, and the patient is then responsible for notifying you. So I don't really have a good answer to that one either, except no, we would not be the one doing that. Anything else, Ashley?
That's all we have for now.
All right, so our first question relates to incarcerated patients. And do incarceration patients lose their Medicare coverage while incarcerated? And I want to answer this question in kind of a double-fold manner. First, no, they do not lose their Medicare eligibility. However, CMS does state that you cannot bill us for something that is the responsibility of someone else to fully pay. In this case, if they're incarcerated, they are under the penal authority, and that penal authority is then required to pay it, right? Now, some penal authorities say, hey, we don't ever pay that. We don't pay that. It's the patient's responsibility, and we're going to send every patient a bill for this. In that case, then you can bill Medicare. However, you better make sure you bill Medicare with the correct modifier, which is QJ. And for those of you that bill on a 1500 or 837P, you need to have condition code 63 as well. So it's really important to make sure you have the right information. Otherwise, we're not going to pay it. So it will go into the system that, hey, they are incarcerated. That comes in through the Medicare eligibility file through the Social Security Administration, not anything that we have control over. And then we have to go through the process of it. So hopefully that kind of helps you guys a little bit. I did have Ashley throw in a couple of links in the chat. Take a look at those. Um, Next question was more about ambulance transports during the incarceration period. It works exactly the same way. Is the ambulance transport covered? Sometimes, however, it's for this or that, and how do they pursue it? It's the same thing that I just gave an answer to. And yes, an ambulance transport may need to bill with the QJ modifier as well. Okay, the patient's responsible for that ambulance transport. They always collect from that. The incarcerated area will not pay for it, or the penal authority won't pay for it. So you really have to make sure you bill that. But again, we at the AB MAC do not determine that. It is determined by the Social Security Administration and what they put on file. Next question, what is the implication of repeating eligibility denials, and is there a written source that we can share with the front desk? Okay, here's the biggest answer to that. It is an abuse situation. If you don't do this, you can actually just say, oh, it's not my problem. I don't want to deal with it. If you look at it from that point of view and you think, hey, Medicare's maintaining all of these edits and audits, it is an abuse situation. If you continue to do it after you've been educated, it can be something that can turn into fraud. You know you're doing wrong. You didn't even bother to look, just, oh, let Medicare handle it. Now, keep in mind, that doesn't mean, hey, the patient asked me to, so I got to do it because the patient asked me to. Not the same thing. Just document the patient asked you to. The patient's asking you to do all kinds of things, and you do have to follow that guidance. All right. Next question, is anything changed with Medicare eligibility? And the answer is no, but it could be a change that we're not aware of or that we don't look at individually, such as that Medicare card. Yes, the Social Security Administrator updates it. We just simply check at the time what the number you used. Okay. Um, how do we determine who to bill when auto or workers' comp is Medicare secondary payer, which makes Medicare secondary to them? You need to check the SecureNet Access portal in the eligibility file, and you're looking for the MSP data, the Medicare secondary payer data. It's just like what I talked about, one of those little tabs that you looked at. Check that out. That'll give you what you need. Um, why are there so many denials for first-time submission and approved the second time around? The answer is this normally happens when the record is updated. So did you check everything? Is everything current and updated? If not, I don't know, and we'd have to individually look at that claim, okay? Because it depends on the patient. Next question, can we find out if the patient called the Medicare Coordination of Benefits line to update their information? The only way we have to offer that is to see if it's updated in the system We do not know whether they've updated that until a claim comes in and we simply run it against the file, just like you would. The file information again is displayed in Snap, 270, 271 transaction. You also get that on your own. Um, I don't know exactly what this person was looking for. They simply said claims after termination. You don't need to bill Medicare for these. If you look it up and the patient's not eligible or their coverage is terminated, you don't need to bill that. Why? Well, the patient's not eligible. It's their responsibility to pay it. They don't have Medicare. So they could have their Part A terminated, their Part B terminated, all of it terminated. They could have it terminated due to the Social Security Administration stating they're no longer disabled or no longer have end-stage renal disease, whatever the situation is. As long as there's a termination, they're not eligible. They will still have a Medicare card that makes them look eligible because no card gets sent out to say, hey, you no longer have coverage. So they're going to present you with a valid card. Now you need to check the system and look at that termination date. So, yeah. That also brings me to the next one is how do you work for denials? And my first answer to you is always check the system. You may have checked it. Something may have happened in the meantime. We may have gotten additional information. The 270, 271 transaction may be updated, which then means that the claim system does something different. So we got to have a look and see what's active, right? That's our number one step. Then you need to determine, yes, this has been updated or no, this has not been updated. If it's not correct, the patient needs to work with Social Security, maybe the Benefit Coordination and Recovery Center to update their primary payer information. There's a variety of things that can happen there, but each one is based on the denial itself. Um, so there was a question about can you resubmit a claim after the coordination of benefits system or has been updated, and the answer is absolutely. So there's a primary payer. It gets updated to say it's not primary. What do? You do just simply want to resubmit that claim. Start over. Medicare is now primary. Yep, let's do that. All right, that's it for my pre-submitted questions, and I just want to ask Ashley any questions in the chat that came in while I was talking.
Nothing else in the chat?
Perfect. Let's go on then. So let's take our survey. I'm going to have Ashley throw a link to it. The survey just simply gives us feedback. It is 5 questions. You say yes, you want to give us additional feedback, you will be presented with more questions. So it is an opportunity to answer the questions. Again, there's a link in the chat. You're going to get a little pop-up box like the right side here. You're going to have a little triangle. I'm going to give you the destination and give you a continue button. Please take that survey. On the encore, or if you're watching this video again and you want to give us this feedback, you can definitely do that. You're going to get a picture that looks like the bottom picture. It says online survey, little hand pointing to five stars. You can select that. It'll open up a link to the survey. But please give us any feedback you have. This does go to CMS and it does go to us. We can take the opportunity then to look at that. So I do think that that's a great opportunity for you to provide feedback. Little bit of close up. Remember I said I'll take questions for 7 days following the webinar. How do you do that? You're just going to email us. Put patient eligibility webinar, patient eligibility in the subject line. And again, it's the same email I gave earlier. I'll give it to you one more time. It's wps.gha.education@wpsic.com. Along with this, if you dialed in, you need to email us. I don't have an email for you. What I have is a phone number with an area code. So if you did not use the computer and you did not provide that email, I can't give you a certificate because that certificate comes out with contact hours automatically from the system. I don't do anything to do that. It's just going to come out to you. So if you did dial in, I need a phone number from you. So you're going to email the same thing, use the same subject line, give me a 10-digit number and say 10-digit phone number and say, hey, I dialed in. Can I get a certificate? We'll get one to you. All right. We'll get it to you and respond with an email. So either way, please email me. We'll get that back to you. That's all we have for today. We want to thank you for listening. Ashley and I will encourage you to take that survey and give us some feedback. Remember to look at our live events page for more additional information. Don't forget that we will post this recording as an encore presentation that's available to you. So on behalf of Provider Outreach and Education, thanks for your participation. We look forward to your survey comments and attending more education in the future. You may now disconnect.